I'm Farah Duro, and you're listening to the PCOS Revolution podcast. Hello, and welcome to the PCOS Revolution. We have today with us Jessica, who is actually a patient of mine, and she's here to share her journey of how she coped with three different things that were holding her back from conceiving, and also just having a normal cycle. So I'd like to welcome Jessica. Thank you for coming.
Hi, Dr. Duro. Thank you so much for having me.
I'm really excited because this is something that we've been talking about for a while, just having you share your story. And I think it's really incredible. I'm so glad that you're able to do this. And I just wonder if you could just take us back to the beginning of really like when you started noticing that something was off with your cycle.
Right. Well, I'd been on the birth control pill for about 10 years. Um, I went on it when I was about 24. And before then, I had pretty normal cycles, nothing out of the ordinary, I would say. But up until that point in time, I also had a pretty, I would say, normal life. I wasn't too stressed. I had a pretty normal weight, and I ate pretty well, exercised. But right around when I turned 24, things started changing for me a lot. It was my first encounter with my eating disorder at that age, which is kind of older in the eating disorder world, but that's when it happened for me. And that's also when I decided to go on the pill. Um, and so my journey sort of started about 10 years after that when I was married, and I was just trying to recover from a second very, very severe relapse of anorexia. And I went off the pill, ignorantly thinking that if I gained 15 pounds, then everything would go back to normal like when I was 16. But that wasn't the case. Um, I was 34 and my body did not bounce back. And I waited several months and I still had no cycle. And I decided to immediately go to a fertility clinic because I wanted to have a baby immediately. Because of my age, I was very nervous about it. And she took one look at me and she's like, well, your BMI is 18 now. It's in the normal range. You should have no problem if I give you these drugs. So I went through 3 courses of injectable medications. I was on an extremely high dose, probably the highest dose that you can take. It was twice a day. I was injecting myself with 4 vials of this medication. And all 3 cycles, I had a lot of immature follicles, some eggs, but I never conceived, not even a chemical pregnancy.
And before that, how long was it that you didn't have a period, I guess, when you first when you got off birth control, like how many months were you without a period?
Well, it was almost a year before I finally got my period back. I had periods induced by these medications, but to have a natural period took me 1 year and I had to gain 65 pounds.
Wow, wow.
Yeah.
And so when you saw the fertility doctor, it had been how many months since you'd, gotten off birth control?
It had only been like 3 or 4 months. I just was very impatient. I was impatient and I didn't know. I was sort of in denial about what it really was going to take for me holistically to get back to equilibrium. I thought medicine's just going to fix it.
Right.
um, it's just going to fix it. It doesn't matter if I'm still recovering from anorexia. Medication can fix it. Um,
And I think that's a common misconception. It's really one of those things that are just built into our culture. It's like, here, take a pill. You'll get better.
Exactly. Exactly. And I think, gosh, the weight issues, like, I think medical professionals just do not have a lot of background on um, on eating disorders and on how the female body functions optimally, and what having a healthy cycle actually means for your full body health.
Right.
Um,
And then once you were started these fertility medications, how let's talk about how did your body react?
I felt like what I imagine a chicken in a coop being stuffed full of hormones feels. I felt like it was an out of body experience. Every single day, I was just getting more and more bloated, and I gained weight incredibly rapidly on these drugs. After every cycle, I was up another 12 pounds within a week. It was incredible. I mean, I went from, at my lowest point, my BMI was 14. Um, and when I went in for that first ultrasound with this doctor, my ovaries looked like a 7-year-old girl's. They were almost undetectable on the ultrasound. Um, and by the time I finished with her after 3 cycles, I was up to 170 pounds, which is basically the top for my height. I was like at a BMI of 25, and I was incredibly uncomfortable in my body. I needed to gain the weight, but it was very, very rapid, and it was a very, very hard experience. Socially too, going from a size 00 to a size 12, um, it was kind of embarrassing, you know.
And this was mainly triggered by when you started the fertility
It
medications.
was. It
Hmm.
was. Yeah, it was an unnatural amount of weight to gain in that short of time. Um, and no, sorry, go ahead.
Oh no, I was just thinking about when I first saw you is when you came from that clinic, I think. Yes.
Yes. So what happened was, after these 3 failed cycles, I didn't know this. She kind of never explained this to me. She said, "Well, the protocol is now for you to go to IVF." And I was just taken aback. I said, "But I'm not ready for that. And aren't there other things I can do?" And then she talked to me about adoption, and I was like, "You know what? I feel like there has to be another way." I felt, when I was younger, I never had any of these problems. I never had a problem with my period that I noticed. So that's when I decided I'm gonna stop, and I'm gonna explore some other routes here. And that's when I found you.
That's yeah. So I remember looking over your labs too, and I'm like blown away about what was kind of noted there was that really it was just pushing and pushing and pushing your ovaries, and nothing happened, right? I mean, there was no ovulation, I don't think at all, or no response, I guess is what I'm trying to remember.
Very low
Hmm.
response. Yeah, I
Yeah.
wasn't a good responder. Um, and then I found out, kind of after that, that I had polycystic ovaries too. Um, and they never really talked to me about that. Um,
Yeah, I think you were kind of an enigma to them.
right.
So, and so, when we started looking at kind of square one is basically like, let's see what you can do on your own. And so what changed for you in that moment when you started thinking about a different approach?
What changed for me was that, I mean, I feel like, not to, this is not a promotion, but I do feel like you were the only person, a medical professional, that looked at me holistically and said, "Okay, this is your history. You need to just get to equilibrium. You are not in equilibrium. You went from like extremely thin to, overweight for your comfort level. You just went from one end to the other, and you need to get back to your equilibrium." And what really worked for me was, doing the acupuncture twice a week, and focusing on mindfulness, and the herbs. We did a lot of herbs and supplements, and 2 months after that whole treatment, um, I got my cycle back, and then a month after that, I was pregnant with my daughter, and kind of
Yeah, that was an
continued.
amazing
Yeah,
thing.
I know. Continued the same protocol throughout the pregnancy, and it was the most amazing, easiest pregnancy and birth experience ever. I had no complications, gave birth extremely quickly, easily, water broke naturally. You know,
This is definitely not a paid endorsement. I did not pay her to come over here and say this, but it was actually to the point where I'd referred you to another reproductive endocrinologist, I think, when you came in. I remember,
right.
and it was like, I said, well, because it was a very complex case, and I thought, let's see, like maybe if you switch and we can work together integratively, like we can see what's going on really. We knew that your body was under a great deal of stress, and you were definitely not ovulating. So I think that, and when you showed up at the IVF clinic, for the other doctor, he kind of, I think you were actually pregnant at that point, or you had just found out, or something like that. I'm not
Yeah,
sure.
I did.
and and so he said, well, everything looks great, and I think that was, he did your ultrasounds in the beginning, which was really nice to have, like someone that actually had paid attention. Because a lot of times when you're especially newly pregnant, the gynecologists don't want to see you until you're 6 or 8 weeks along. So, and being going through everything that you've gone through, I think it was something that it was really nice to just kind of validate, like, okay, my body is working. I'm shocked, and this is happening really quickly, but you know, um, looking at things on an ultrasound and actually being monitored a little bit, I think it gave you a little bit more peace, you know.
Yeah, and that's sort of the key, like having faith that your body can work. And the other piece that I forgot to mention was the diet too. Was eating and eating eating well, and trying to incorporate the fertility boosting foods every day. Whole eggs, spinach. I was eating a lot of almonds, just
Yes.
trying to get the healthy fats in, as much as I could.
Right. And I think that the meditations were great too. Just
Yeah,
trying to incorporate those, and I think that was just trying to think back of all the things that I think were really beneficial. Is just having that time to really, be with yourself and just really kind of get accustomed to being in your body again and being, comfortable with that. And I think that there's meditations actually that are good for body image, and we've done some things just for, fertility and that sort of thing. So playing these meditations during the acupuncture session, I think, was really helpful. And there's also the point where we did the Blossom protocol, which is the 4-phase Chinese herbal approach, and that, in addition to vitamin D, I think you're vitamin D deficient. We used omeprazole, essential fatty acids, like a really high potency essential fatty acid, or omega 3, and along with a really good quality prenatal. And I think I gave you some pretty nasty herbal tea too.
yeah.
It wasn't so bad. And that was the protocol we did. So it was 4 stages, and it helped your body. I would say create a cycle, but it actually helps you get to the point where you could ovulate on your own. And
Right.
we didn't know how fast that was going to happen, though. That was pretty fast, in 3 months. But so then fast forward to after you had your daughter, and it was, I've been, I guess, a year later, right, where you came back in.
That's right. So after I had my daughter, I was really anxious to see what my body was going to do. And I said that I had a really easy pregnancy, and I did, but postpartum was a little bit harder for me. They say that if you've suffered from depression and anxiety in the past, you're much more likely to suffer it postpartum, and that's what happened to me. I've I have an anxiety disorder, so I kind of was expecting this to happen, and it did, and it was very hard to deal with postpartum, and um, my cycles when they did come back. A couple months after I weaned her, they were wonky, really wonky. And because of my age, again, I wanted to start trying quickly. And I knew that what had worked for me in the past would work for me again if I could get back to that good equilibrium.
Hmm. Right. So it wasn't like your cycles just came back perfectly 28 days and no
No,
problems.
not at all. I was very into charting them. As you know, I took my basal body temperature every morning. I was checking my cervical fluid and I was charting them every month. And I was patient this time. I was trying to be more patient, waiting for a change to happen. But after 8 or 9 cycles, of an extremely short luteal phase of 7 days, I knew, based on what I had read, that that was going to be a big problem for getting pregnant. Um,
Right. And also, I think we left out an important part is that your hubby came in for some treatments too.
yes, he did. He did, and I think it actually helped him with finally quitting the smoking. That was a big thing. That was a big block too. For him because he was a smoker and that is not good for a lot of things, but definitely for conceiving.
Yeah, and it was very sweet. You guys would just come in on the Saturday and just have a like little side by side couples treatment and
It
kind
was
of,
it was
yeah.
nice. It was very relaxing, which
Hmm.
really really helped.
Right. I mean, he was actually pretty good with the herbs too. He did have, um, a pretty consistent schedule with that too. And I always say, like, natural treatment it takes two. If always we're trying to get the husbands in, the partners in. It's so nice to actually have that support too. And they don't realize how stressed they are until they actually just lay on the table and they're like, oh, okay, now
Yeah, I
this
know.
is what I've been missing.
I know.
So we really encourage. But so as far as thinking back when you came back and your cycles were kind of all over the place, you were feeling a lot of anxiety, and also the fact of thinking, is this going to really happen again? Because you wanted a second child, right? And not sure if how hard it would be, and all of that. So, so tell us what happened next.
Well, what happened next was you and I decided that the best course of action was to try to just replicate what we had done before,
Right.
since it worked so well. So I committed to coming in twice a week for acupuncture again, doing the blossom herbs and teas, and trying to do as much mindful meditation as having an infant would allow. Um, and it did. It worked again.
And
Happy to
I
say.
think it was almost, was it 3 months this time or 4 months? I can't remember exactly if it was 3 or 4.
It took about 3 months
Three
again.
months, right? Again, yeah, that's
Yeah.
like your magic number. Yeah.
Yeah.
We always say that
Yeah.
to patients. Oh, it's going to take 3 to 6 months to regulate your hormones. And it's like, oh, it's not an overnight process. And it was like 3 months exactly.
But
Um,
it's actually kind of a short amount of time when you
it
think about it.
is. Well, if
It's
something's
really,
been
really
going on your whole life, that's what I
yeah.
say. Like, and with you, I think it was the confusion was that you had two different things going on. I mean, you have polycystic ovaries and then the hypothalamic amenorrhea, from also the eating disorder. So it's like so they might think, oh, you're not ovulating because of that, or it's because of, but it's kind of more, I guess, challenging, to figure out what the right combination would be, I guess, medication wise, and especially since your body didn't respond to medications.
Right.
So,
It didn't respond at all.
right. And sometimes you just see it go different ways. So if somebody has PCOS, they start stimulation, nothing's happening. It's like they're just resistant. And then all of a sudden, boom, there's 70 follicles. It's very uncomfortable and all those things. It depends on the protocol they're on, but you didn't have to go that route. You didn't do IVF. You're very close to doing it, but didn't do it. And I think Did you go back to the same doctor? I think you did.
I did because I had scheduled an appointment with him to talk about the luteal phase defect, and I went in there, and I was already 4 weeks pregnant. So,
Yeah. And he said, "I can't help you anymore,"
right,
or something like that. Or, "I
he
wish I
was
could have helped
nice.
you more," or something like that.
He
Or they were
he followed me for about 5 more weeks, and then discharged me to my OB. But he had kind of started to talk to me about, like, well, if for some reason, God forbid, this pregnancy doesn't work out, like, the way I would treat you now is we'd go straight to Clomid or an oral drug to help your luteal phase. And after my first experience, I would be very reluctant to take any of those drugs again without at least exhausting the natural options available to balance your hormones.
And I think we left out an important part when you mentioned the luteal phase defect is that we use progesterone cream.
Right. That's huge. That was huge.
Yeah, yeah, because I mean that along with the herbs, and you use it in the second half of your cycle. You were charting, you could see your cycles getting longer as far as that just lengthening out. That was, I think that was pretty big. I mean, you were also taking oral progesterone from your doctor, correct?
Right.
This
Mhm.
cycle, not for the first one though. I think it was just the cream for the first one. I want to say.
Right. Right.
Right. In this case, you had seen your gynecologist and they said, okay, here, just, take the progesterone orally since we know that it's a luteal phase issue. So then, you had kind of covering that with that. So then let's say you found out you were pregnant for the second time and you went back to your doctor and then what?
It was not as blissful as the first because I went back to my OB that had delivered my daughter, that, well, she didn't deliver, but treated me during my pregnancy with my daughter. And I don't think she was very accustomed to seeing patients who had a lot of deep knowledge about their own bodies or were in sync with their bodies. Um, and I went in there very early because I wanted her to make sure that my progesterone was okay because I was worried about that with the luteal phase. And she agreed to see me, and my HCG, my pregnancy hormone levels were extremely low, and she monitored them for about a week. And based on those numbers, she told me you are 99% likely to miscarry because your numbers are not increasing as they should. Um, and once again, I mean, you were my advocate, and you said you need to wait. You need to just wait and see what happens because it's not an exact science. And I went in again, and she was convinced that I had an ectopic pregnancy and was ready to give me a shot to terminate. And the ultrasound tech was nice enough to to talk to me and to say, I think I see something on here. It's very, very small, but I do think I see a gestational sac that's in your uterus and not in your tubes. And I think that saved me from possibly terminating my pregnancy
A healthy pregnancy.
unintentionally.
Yes.
Yeah, it
Mm.
was really, really scary. And I walked out of that doctor's office, and I didn't go back. I found another doctor.
Right. Definitely, as you should. I mean, and not to mention, going off I don't even think that that doctor was present when the ultrasound was being done, even. So, just going off the low beta, I think it was, the HCG levels, they look for them to double. And I think, yours just started off very low, which can happen, especially if you test early. I think it was quite early. I mean, it really tested probably around, maybe it was you think like a day or two before your period was due or something.
Right.
It
Exactly.
was still pretty
Exactly.
early. So for it to be pretty early, and I think what also they were confused about is thinking maybe that you ovulated uh earlier. I'm not sure like what they were basing that off of. Maybe the last period.
Yeah.
Um and I don't think you have 28-day cycles. I mean,
No, not
to
at all.
right, and that's such a danger zone with PCOS and with anything. I mean, like irregular cycles. It's like if they look at the last menstrual period, if your doctor looks at that, they're going to base it off of a 28 to 30-day cycle a lot of times. If you don't have cycles that are cookie cutter and you don't tell them, my cycles are usually a little longer or I ovulated, you knew exactly when you ovulated, but they took it as a different date. So they're basing that number off of something that actually they're expecting to be larger because they think you're further along than you are. So I think that at that point, basing it off of that, which was not correct. It's just an incorrect assumption that you should have been farther along. And the whole knee-jerk reaction was that, oh, it's probably a topic. We need to give you methotrexate and terminate this pregnancy. And and maybe they were trying to practice, protective medicine or who knows. But I think it was a real knee-jerk reaction. And the fact that she didn't change her opinion even after the ultrasound tech said, hey, I think you have a viable pregnancy. She was still insistent. So I think that was just really alarming. And I'm glad that you switched
Yeah.
gynecologist. So basically everything you went back to the IVF doctor still that had been kind of helping with the follow up or giving you ultrasounds, and he looked at your ultrasound and said everything was fine. Yeah.
Yeah, we
Hmm.
did 2 more ultrasounds and everything was progressing normally, and then, I went to the OB, and then I went to the perinatologist because I'm advanced maternal age, and genetic tests, and everything was normal.
I just,
So,
yeah, yeah. And then as far as what week now are you in your pregnancy?
14,
14 weeks. So
fourteen.
you're officially out of the first trimester.
Yeah.
Awesome. Yay. Yeah. And just like trying to get the cortisol back down, the stress and anxiety of all the first trimester was just rough, I mean, I think you didn't have much nausea. You were feeling fine. It was just that it was everything else, and, just working on just getting you through that, I think, and still doing your meditations and trying to, you know to kind of tell your brain it's okay. There's not a reason for worry, and that's so hard because
It's very hard. It's like, I think if you suffer from a hormone imbalance or some sort of infertility, any kind of issue like that, and you go through any sort of treatment or consultation on it, it's like post-traumatic stress. It does not ever leave your brain again. You are always thinking there is something wrong with me, but that can't be fixed.
right. And especially if someone's telling you, well, there's something wrong with your baby. I mean, that it's very difficult to get through that, and try to get the negativity out of your head, and it's just not true. So it's just something I think that we felt so strongly about. I mean, telling other women that this is a definite reality. We see this a lot with someone with, someone who has irregular cycles. That there are just a lot of doctors that are not used to dealing with irregular cycles, and they're just going to treat you like a cookie cutter way. And those are the ones to stay away from. They really
Yes,
are.
they are.
They're
It's so
great.
true.
They're really great with easy cycles, easy pregnancies. But when there's a challenge and you have to think outside the box, that's not where you want to be. So I'm glad that you did find a really knowledgeable OBGYN who's able to treat you as an individual and going to go through where you are with your pregnancy and look. I mean, really, you can also look at the 6-week ultrasound that they do usually to date the pregnancy rather than the last menstrual period, and that would be more accurate, I think. So I mean, it is such it's just such an anxiety producing experience to go through that, but especially given what you've gone through before. So I hope that the next few months of your pregnancy go amazingly smooth, and I'm sure they will. You're doing really amazing, and I think that just sharing this right now, it's going to actually help somebody out there who has experienced irregular cycles and maybe they are pregnant and they're trying to explain this to their doctor, or trying to find somebody who is actually a little bit knowledgeable. So, I mean, I guess what other advice would you give somebody who's I guess who's trying to get pregnant with PCOS or who is pregnant currently?
Well, if you suffer from a hormone imbalance, I would say, and I wish I had listened to my to this advice. I would say you have to you have to give yourself a chance to try to heal naturally if you can. There's so many different avenues through lifestyle, as well as natural remedies like acupuncture and herbs that can help you get back to, or get to, if you've never been in an equilibrium. That straight medication sometimes is not the best option, and sometimes cannot just fix a problem. And that there are methods to get yourself to where you should be.
Right. Everybody responds differently to things. And there's not, I think conservative treatment is giving your body a chance, like you said, and really
Yeah.
just, also we know that sometimes Clomid can raise your miscarriage rate as well. So that's something that I think it'd be, if everybody would try just maybe for, like you did, 3 to 6 months, see what their bodies can do. There's no harm. It is not going to actually age your eggs and all this tremendously. I mean, you have that. It's probably doing the opposite, honestly, getting your body healthier in preparation for pregnancy. So that being said, we were talking earlier about a book that you thought was really helpful, and I really agree with this. I think it'd be one of those required readings for so many women. You just talk a little bit about what book really has helped you.
The book that really helped me was Taking Charge of Your Fertility by Toni Wexler. And it's really about learning your menstrual cycle and how to interpret certain signs, and just really how the menstrual cycle is part of your overall health as a woman.
Yeah, that's a fabulous book. And she's also got all her BBT charts on her website too, to help learn how to chart your temperatures, and great charts. Actually, there's like even a little area where you can mark your acupuncture treatments and the herbs you took, and symptoms you're having. And it's really, I love it when people bring those in to treatment. It's like, oh, yay, your report card.
Yeah, that's exactly what it is. I mean, it can tell you a lot. Your charting can tell you a lot about how your body's functioning. I mean, if I hadn't been charting, I would have no idea that I had a luteal phase defect or low progesterone. I would have just thought, I would have thought nothing. I wouldn't have known. And I wouldn't have known that I had ovulated, that I ovulate later, or that I have irregular cycles. And maybe I would have gone to the doctor and taken that shot because I didn't know that it was still pretty early. So,
Right, exactly. I mean, it's a wonderful thing. Even you can find out if you're pregnant actually before you even take a pregnancy test when you're using those charts. So you've done that many times with PCOS, especially because it's so hard to figure out when you ovulated, or especially if you have a long cycle. So that's really one of those key things that I think are extremely helpful. So I just want to thank you so much for sharing with us, Jessica. And I really appreciate you taking the time out of your busy life. And I wish you all the best with your pregnancy. And thank you for listening, everybody. Hope you have a great week. And that's the end of this episode of the PCOS Revolution podcast. If you've enjoyed the show and want to help me spread the word about how women with PCOS and hormonal imbalances can lead happier, more healthier lives, please head over to iTunes and leave us a review. They really do make a difference. If you'd like to have a question answered on the show or would like to recommend a guest, please go to floridacompletewellness.com/podcast. If you're on social media, you can follow me at facebook.com/FloridaCompleteWellness and twitter.com/FloridaComplete, where I post a lot of interesting research, webinars, and articles on our blog about really getting to the root of hormonal imbalances like PCOS. So it's a great way to stay in touch with the latest developments. Thanks so much for listening, and see you soon.